I'm recording this at a time when we've had confirmation of our first cases of the Omicron variant in Torbay. We've also heard from the Prime Minister of the first death associated with this variant in the UK. We are concerned because although the information is changing rapidly and is likely to be updated even as this update goes out, there are some things that we're reasonably sure about. The first is that this variant spreads rapidly. It is likely to become the dominant variant in the UK. We also know that it is likely to escape some of the protection that the vaccine offers. However, the indications are that this variant is associated with a milder form of illness than the Delta variant. However, because it spreads so rapidly, it has the potential to overwhelm our health systems, even if it doesn't cause severe disease as commonly as the Delta variant, in those who are unvaccinated in particular. It is like thinking about all the rain that would fall in a month happening in one day. Yes, it mightn't be a particular severe form of the disease, but if you suddenly have a lot of cases happening at the same time, then it puts our health system, which is already on the strain, at breaking point. This is why it is so important that we consider what we can do to limit the impact of the Omicron variant, and indeed to think about this as what we need to do for when other variants emerge. Because unfortunately, in the 2 years of dealing with this pandemic, one of the things that we can be sure of is that new variants will continue to emerge. It's therefore important, first of all, that we understand the importance of the vaccine program, and particularly of having a booster. The early indications are that although the vaccine does escape some protections from those who have been doubly vaccinated, that having a booster dose restores that protection to a great extent. We have just seen the first anniversary of the first vaccine given anywhere in the world, and it happened here in the UK. And that program over the last year has essentially broken the link between infection and severe disease and hospitalization leading to death. So we can build on that very positive program that has given us such hope and changed the face of the pandemic in the last year. The other thing that we need to do is to recognize that as important as the vaccine program is, and as important as having the booster jab is, that we must supplement that with activities that will reduce our chances of spreading the disease to others or becoming infected ourselves. I've been saying that in the last few weeks, our case rates have been very high. They've been largely among children aged under 15, but we see a secondary peak, which has been rising over the last few weeks in those who are 30 to 39. Many of those are associated with school and educational settings, but many are also the parents of those school-aged children. As we go into the Christmas period and people socialize more with family and friends, people visiting each other they've not seen for quite some time, the concern is that the over 60s and those groups that have more underlying conditions or are more likely to have severe illness if they become infected, there can be a jump into those populations. In fact, in the last few weeks, we have kept the rate of infection in those over 60 has been low, and we want to keep it that way. But clearly, if we have older people coming into families where the infection is circulating, there is a risk that they can be infected as a result of that. So those key messages of hand, face, space, and fresh air are especially important. Let's maintain social distancing as much as possible. Let's limit unnecessary social interactions where possible. And where we need to be out and about, to use face coverings as now required, maintain hand hygiene, and maintain ventilation, to keep windows open where possible, to flush the air through so that virus particles do not build up. Where possible, where we're entering into situations where we may be at risk ourselves or we may risk transmitting to others, it's important to test regularly. It is possible for us to have a safe and enjoyable holiday period. Let's act responsible. Let's continue to do those things that will protect ourselves and others, so that we have the best of the holiday season and remain safe. Best wishes for the holidays. Thanks.